to become insulin resistant. The second theory proposes that the initial problem is insulin resistance in muscle tissues, fat cells, and the liver. As a result, the beta cells increase insulin secretion to keep blood glucose in a normal range. However, over time, the beta cells are unable to keep up with demand and lose their ability to produce sufficient insulin. Whichever problem begins the process, the result is the same as for type 1 diabetes. Glucose builds up in the bloodstream, and the body cannot use its main source of fuel effectively. Recent research has focused on a constellation of abnormalities called metabolic syndrome, previously called Syndrome X. It is estimated that up to 1 in 4 Americans has this syndrome, and it is strongly associated with type 2 diabetes. People with the metabolic syndrome are usually overweight or obese, especially around the waist, and have an increased amount of intra-abdominal fat in this area, which some researchers believe causes their tissues to become increasingly resistant to the effects of insulin. As a result, the pancreas produces and secretes more insulin, which over time may exhaust the beta cells. The cluster of disorders that characterize the metabolic syndrome is thought to be caused by these pathologic changes. Those with the metabolic syndrome have high blood pressure, abnormal blood lipids, increased fasting blood glucose levels, high triglycerides and low HDL, and several disorders in blood clotting that make it easier to form clots in blood vessels. In addition to having an increased risk of developing type 2 diabetes, persons with metabolic syndrome are at a high risk for developing cardiovascular disease. Let's review this section. Type 2 diabetes is a chronic, progressive disease that affects the great majority of those with diabetes. It is more common in those over 40, who are overweight, sedentary, are members of certain ethnic groups, have a family history of the disease, or have the metabolic syndrome. The dysfunction in glucose regulation is due to decreased insulin production by the beta cells and/or increased insulin resistance in muscle tissues in the liver. The signs and symptoms of type 2 diabetes are not nearly as dramatic as those for type 1. In fact, the average person with type 2 has the disease for 7 or more years before diagnosis and may not present with symptoms or signs of the disease. As a result, high blood glucose levels have damaged blood vessels and caused serious complications long before the person even knows she has diabetes. Some of the signs and symptoms of type 2 diabetes are similar to those with type 1 and include polyphagia, polydipsia, blurred vision, fatigue, frequent infections, and